Welcome to Frederick Regional Hospital's Perioperative Services Department. I'm Lila Boyu, Director of the department. Our vision is to provide you with superb quality, superb service all the time. We're happy you're coming here, but we understand you might be anxious about your upcoming procedure. Our capable staff is here to assist you with your questions or concerns you might have throughout your visit. This video will guide you through each of those steps, beginning with the pre-admission phone call you may receive from one of our screening nurses through your discharge from FMH. Our goal is to provide everything you need to make your visit with us a very good experience.
Hello, my name is Donna Ecker. I'm a registered nurse at Frederick Memorial Hospital. I work in pre-admission screening services with Perioperative Services. One of our pre-admission screening nurses may call you several days before your surgery or procedure. The call usually takes about 10 or 15 minutes. If we aren't able to reach you, we can take your health history on the day of your surgery. The pre-admission screening nurse will be asking for your health history and documenting it in our computer system. This may include your height, weight, and any medications or food allergies you may have and the reactions to them. She'll also ask for the names, dosages, and frequency of the medications you currently take, including prescribed, over-the-counter medications, vitamins, supplements, and herbals. The nurse will review what medications you should take the morning of your surgery. Please remember to bring a list of your medications and the last date and time you took them. The nurse will also ask you to identify when and where you had preoperative testing or consultations with medical, cardiac, or lung specialists, so we can contact them to obtain the results. It's important for you to know you have certain patient rights while you're here, which include the right to ask questions, participate in your care, and even to refuse treatment that you don't understand. You also have the rights to comfort, privacy, and safety. On the day of your surgery, please report to the main entrance and check in at patient registration in the hospital lobby. A valet service is available for your convenience. Please wear loose, comfortable clothing and leave all jewelry and valuables at home. Ladies should not wear makeup. If you use a CPAP or BiPAP machine at home, please bring it with you to the hospital and give it to your pre-op nurse. We need to know your normal settings in case it's needed in recovery. You are not to eat or drink after midnight the night before your surgery. Please make sure you have arrangements for someone to drive you home if you expect to be discharged the same day. We look forward to giving you very good care while you're with us.
Hello, my name is Danielle and I work in the Patient Registration Department. Your first stop on the day of your procedure will be to our area located near the main entrance of the hospital. You will be greeted by one of our administrative assistants who will enter your name on our daily sign-in log. She will then direct you to the next available registrar to complete your paperwork. The registrar will review your demographic information with you and obtain copies of your photo ID and insurance card. She or he will also review insurance documents with you and ask for your signature. This process usually takes no more than 5 to 10 minutes to complete.
Hi, my name is Jane. Welcome to the surgery waiting area. This is your next step after registration. First, we'll check you in on the computer to let the pre-op area know you're here for your surgery or procedure. As soon as we receive the pre-op room number, I will then take you back to that area to meet the pre-op staff. In most cases, your family member or friend can go back to the pre-op area with you. I will explain the family tracking system to the person waiting for you. Using this screen and your assigned PIN number, they'll be able to track your progress from pre-op to the operating room and into recovery. It's very important your friend or family member checks in with the surgical information volunteer to let them know they're here waiting for you.
Hello, my name is Jack and I'm a volunteer at the Surgical Information Desk. I'm here to keep your loved ones informed of your progress during your surgical procedure. When your procedure is about to begin, your family will be directed to the waiting area and will be asked to register with me. I need to know that they're here waiting for you so that I can help the doctors and the nurses find them when they have an update on your condition. During the procedure, your family member, significant other, or friend will also be able to follow your progress using this large computer screen on the wall. I'll explain to them how it works. I'll also talk to them about the anticipated length of stay for your procedure and what they can do while they're waiting based on that time frame. Unless he has to go immediately into another operating room, your doctor will make every attempt to come to the waiting area after your procedure to discuss your surgery with your family. If he is able to meet with your family, he will call and ask me to take your family members into one of the private consultation rooms where he will join them. If he is unable to come to the waiting area, he will have the nurses in the recovery area call to update your family. Either way, your family will be kept informed of your condition. During your recovery period, your family will be understandably anxious to see you. However, for the most part, family members do not go to the post-anesthesia care unit. This is an infection control issue for your safety and the safety of the other patients. Some exceptions may be granted for special situations. After you've had time to recover from the anesthesia, your family members will be directed either to your room if you're being admitted or to the discharge area if you're being sent home, whichever option your physician has chosen. We know that having a family member in surgery is a stressful situation. As surgical information desk volunteers, we're here to make your family members as comfortable as possible while they wait.
Hi, I'm Delilah Brennan. I'm one of the nurses in the same-day surgery pre-op area, and I will be getting you ready for your surgery. On the day of your procedure, you'll be brought back to the same-day surgery pre-op area where you'll be shown to your private cubicle to prepare for your procedure. One of our staff will record your height, weight, and vital signs, and please give us any paperwork you might have at this time, which could include notes from your doctor, lab or EKG requisitions, medicine lists, allergies to medicines, or any information you might have about your health history or advance directives. We'll also verify your full name and date of birth at this time. After you and our staff member have checked that your name band is correct, it will be placed on your wrist. Staff will check your name band at key times to ensure your safety. If you prefer to be called by a nickname or a middle name, please let our staff member know. We'll make a note on the front of your chart. Then it's time to change into your hospital gown. If you need to use the bathroom, please check with a staff member to see if a urine specimen is needed first. Safe containers will be provided for glasses, hearing aids, or dentures. Any jewelry or personal items like purses, wallets, or cell phone you didn't leave at home should be given to your family or placed in one of our lockers for additional security. Your pre-op nurse will work with you for approximately 45 minutes to an hour to make sure you're ready for your procedure. The nurse will perform a brief physical exam focusing on the area of surgery. If you received a call from our pre-admission screening nurse, your health history, medications, allergies, and any prior surgical procedures should already be in our computer database. At this time, all data will be verified and placed in your chart. We'll need to know the last date, time, and dose of each of your medications. If any lab tests, EKG, or X-rays are necessary before your surgery, we'll take care of them along with any other tasks ordered by your doctor. This might include scrubbing or hair clipping for orthopedic procedures. After asking if there are any special considerations or requests regarding your IV site, our expert pre-op staff will start your IV, taking special care to make this experience as quick and painless as possible. Your nurse will verify your time of surgery and its expected duration. After a brief review of what to expect in the recovery room, your family members will be informed about the family waiting area, post-op physician conference, and when they can expect to see you after surgery. Admitted patients will go to their assigned rooms, and their families will meet them there. Patients being discharged to go home will meet their families when the patient is ready to leave the hospital. Your nurse will explain the pickup process. Please make sure your family member is prepared to meet with the recovery nurse to review your discharge instructions. Although our goal is to keep all of our surgeries on time, there is potential for surgeries to be delayed due to unforeseen circumstances. Sometimes your doctor may be urgently called to another case, or the previous surgery may run longer than expected. Our staff will keep you updated regarding a delay should one occur. Shortly before your procedure, you'll be visited by your surgeon, your anesthesiologist, and your operating room nurse. They will answer any further questions you might have and will take very good care of you throughout your surgery.
Hello, my name is Jamie, and I am one of the nurses from the operating room. The first time that you'll see the members of the operating room staff, you should be finished or almost finished getting ready in the pre-op area. The surgeon, anesthesiologist, and the OR nurse will speak with you prior to taking you back for your surgery. Although we have looked at the information in your chart, we will be asking you a lot of the same questions. This is a safety check for you, and it's very important. Once we have all spoken with you and the surgeon has marked the operative site, we will be heading back to the OR. The OR will be cold. We keep the temperature low for a number of reasons, such as keeping bacteria levels at a minimum and keeping our surgical staff comfortable while they are working. This being said, keeping you warm is one of our top priorities, especially to help promote post-op healing. We have warming blankets on the bed underneath the sheets, and upon entering the OR, we'll be giving you some warm blankets. And once you are asleep, we can put specialized warming blankets on you as well. Once you're in the OR and have your warm blankets, we'll have you move over to the operating room table. It's very narrow, so please be careful as you move over. When you're settled in, we'll give you some arm boards to rest your arms on and apply monitors so that we can watch you while you're with us. We'll put a blood pressure cuff on, an EKG to watch your heartbeat, and a pulse ox to watch your oxygen levels. We will also place a safety strap across your thighs. This is just a reminder as to how narrow our bed is. Next, your anesthesiologist will start giving you medication through your IV to help you relax. Due to this medication, you may not even remember being in the OR at all. At this point, we will have you take some deep breaths of oxygen through a mask, and your anesthesiologist will put more medication through your IV as you drift off to sleep. A breathing device may be inserted to assist you with breathing or to keep your airway clear. If you have a breathing device, you may wake up with a sore throat. After your surgery is complete, we will move you back onto your bed and take you to the recovery room. Although you will be awake prior to leaving the OR, you probably won't remember much until you have been in the recovery room for a while. As you arrive in the recovery room, we will give your nurse a thorough report about your medical history and the surgery that was performed. You will be in great hands there.
Hi, my name is Vicki. Welcome to the PACU. I'm one of the specially trained nurses who will be caring for you after your surgery in the Post-Anesthesia Care Unit, or PACU. Your anesthesiologist and nurse from the operating room will bring you to our area and we will monitor your recovery. We'll measure your oxygen levels, your blood pressure, and your heart rhythm, and do a physical assessment to make sure everything is okay. We will also ask you to identify yourself using your name and birth date. We want to know if you're experiencing any pain, so we'll ask you to rate your pain level using a number scale. 0 is no pain, while 10 is severe pain. Using a scale helps to measure the effectiveness of the pain medication we can give you. Some people have nausea as a result of anesthesia. Don't worry, we have medications for that as well. When your pain is under control, your vital signs are stable, and your oxygen levels are acceptable, you'll be discharged from the PACU, either to your home or an inpatient unit for further care. We understand your family is important to your recovery, but your safety is our #1 priority. If you're going home, your family will join you in the PACU to review your discharge instructions. If you'll be staying with us, your family will meet you in your room.
And last but not least is your discharge phone call. Hello, I'm Sue Kemp, Manager of Periop Services. We're very anxious to know that once you leave our care, you're recovering well. That's why we call each patient who goes directly home from our department. One of our nurses in our perioperative department will be calling you within a few days of your discharge to ask you some questions. They'll ask you how you're feeling, see if you have any questions about your postoperative instructions, and answer any questions or concerns you might have. This completes our online tour of perioperative services. We hope this information we've shared will be helpful to you when you visit us at FMH. Please know that we'll make every effort to make your time with us as pleasant as possible. If you have any questions or concerns, please don't hesitate to call.